immunologist at the Jackson Laboratory and joins us from Farmington in the U.S. state of Connecticut. Doctor, it's a pleasure seeing you. Firstly, what's your reaction to this new WHO report? People had been talking about the figures probably not representing reality, but 3 times more than reported is astonishing, no?
Yes, it's very tragic, but I think very likely true. In fact, some estimates go as high as 20, 25 million excess deaths. Just in India alone, we think that there are probably 5 to 6 million deaths from COVID, more than 10 times what was originally reported. Unfortunately, I think this is really the reality. The virus has caused tremendous mortality, unfortunately, and this is despite the vaccinations.
Doctor, what impact do you think the absence of this data had on our fight against the pandemic?
I think early on the absence of this data probably undermined the sort of the protections that the people should have taken because it sort of minimized the pandemic. I remember the days when it was said that this is not as worse than flu. The mortality is not so high, and so on. So I think maybe some of it was hidden purposefully. Some of it maybe, unfortunately, not purposefully. Perhaps in rural areas in some countries, you just don't know who died for what purpose, for what reason. But I think this might have somewhat undermined the sort of the tragic aspect of the pandemic. For some people, I don't know if that would have made a difference, but others perhaps it would have. Maybe they would have protected themselves more carefully or get vaccinated earlier.
Before I let you go, Doctor, what do you make of the fact that 84% of these excess deaths were in Southeast Asia, Europe, and the Americas? I mean, these are regions with the strongest health systems.
Yes, that's quite surprising. Actually, Africa is not mentioned. South Africa, with the exception, or maybe the northern part of Africa, but no one has reported such excess deaths in Africa. So it is a bit surprising that a lot of this is happening also in Western countries. Even in the U.S., it is told that there's about 100,000 excess deaths, and that's quite surprising. It's unclear why that's the case. Perhaps one reason could be that COVID actually causes quite a lot of symptoms. It's not a typical upper respiratory infection. So a lot of people with other secondary diseases might die because of that disease. However, the trigger is COVID, and they may not have counted as a COVID death. That could explain some of these excess deaths, but it is surprising. I agree.
Dr. Derya Unutmaz, we appreciate your professional perspective on this. Thank you.
My pleasure.